Thank you very much, everyone, and hope you're all having a great day. Just to kind of summarise, we're going to be going over Mandibular Advancement Splints. It's such a big word for such a small little device. It's an alternative to CPAP therapy, although it can be used in sort of milder sort of sleep apnea cases. But we're going to go through everything today to sort of give you a summary of whether it's a suitable thing for yourself or for other people you may know. So just quickly a little bit about myself. I'm a local boy. I was born in Melbourne, so you've got to forgive me. I do support the Melbourne Storm and the NRL. But I grew up in Brisbane, graduated from Griffith University at Southport. So I've been a dentist for about 12 years now. I started this business in 2016, so been in it about 6 to 7 years. One thing to note is that dentists, unfortunately, we do not get any training on sleep medicine at all, and you're probably thinking, yeah, that probably makes sense. A dentist, probably a bit weird that they're doing anything to do with sleep. So in terms of dental sleep medicine and making splints like this, it is a fairly specialised kind of service. So not your average dentist may know how to make these splints effectively. So if you are looking down this path or know someone who might be, it's just important that they've seeked out a dentist who does have that knowledge. But I've now transitioned into this business full time. It's just gotten so busy. There's just been so much interest around it, especially for people who need an alternative to CPAP. So it's now a field that I'm dedicated to full time, doing my master's in sleep medicine, helping to mentor other dentists and getting involved in this kind of area. So yeah, just as I said and alluded to before, what do dentists have to do with sleep? So there are two main areas, but we're really going to just focus on the one. So one is obstructive sleep apnea and snoring, and the other one would be to do with bruxism, which is teeth clenching and grinding during your sleep, which is a very, very complex field in itself, so that we definitely do not have time for that today. But we're going to focus mainly on obstructive sleep apnea in today's presentation and with snoring. So we provide what we call splints to help, and it is basically a treatment option for that kind of disorder. And one thing to appreciate is that there are many, 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 many different sleep disorders, and this is, although it is a very common disorder, obstructive sleep apnea, it is, just one part of the full picture. So for some of you probably wondering what is obstructive sleep apnea, although a lot of people, it's been quite heavily advertised and awareness is growing in this area. A very simplistic way of looking at it is it's a disorder of your breathing during your sleep. Repetitive collapse of the soft tissues, mainly at the back of the throat, or in the upper airway, so in the nasal region as well, which restricts your airflow through sleep. So traditionally people think, someone's choking during their sleep, which of course that's a full-blown apnea. But it doesn't always have to be like that. Some people just simply are not breathing well, so they're just having a bit of a restriction through their sleep. If anyone here has had a sleep study, which is what we use to sort of figure out, are you having these events or are you having these problems during your sleep, then you may know that we kind of grade them in different, what we call severity scales. So, how bad is it? So how bad is it? The numbers are sort of all there. We can grade it from how often it happens. So mild, moderate, severe. So, mild cases it's happening less often, and a severe cases it's happening more often. So that's how it's generally looked at the moment, and a very simplistic way. It's a lot more complicated than that usually for us, doctors and sleep physicians to kind of figure out what's the best thing for you. It's not just a number. So, but that's what people will refer to in terms of how bad is their sleep apnea. So as I mentioned, it generally does happen at the back of the throat, sort of where the palate and the uvula and the tonsils all kind of sit in that area. That is the main area where obstructive sleep apnea tends to occur. Your nasal airway will generally have a part to play in that, but not generally the area that causes the problem. So you got to forgive your dentist if they all of a sudden you go to your dental checkup and they're all of a sudden asking you if you snore or you know anybody who snores. They've probably done a course in dental sleep medicine and since they saw you last. Okay, so your dentist might suddenly be interested in your sleep and you're thinking, why? I'm here for a checkup. That's kind of an odd thing to ask me. But dentists are really probably one of the main people who can screen for these problems in the general public. We see you every 6 to 12 months. We're probably the only doctor who's going to look down your throat almost every single time we see you. And that's really, looking down the throat, we can see lots of signs which are going to potentially cause a risk of sleep apnea. So, some common questions that we might ask are do you snore? Snoring is a high risk sign for sleep apnea. Are you awakening unrefreshed? Are you sleepy through the day? Are you tired? Does it seem like, a bit odd that, everything in your life is fine, but you're just still tired all the time? A dead giveaway is if someone's seen you stop breathing in your sleep, that's an obvious obstructive sleep apnea. But there are a few specific situations where during the dentist, if you are falling asleep through your dental procedure, that might seem the most craziest thing in the world. It used to happen to me a lot in people having root canal out of all treatments. They falling asleep and start snoring while I'm doing the procedure. It's a dead giveaway. So it does happen. So things like that, or your dentist always finds it hard to get to your back teeth. You've been told you've got a small mouth. It's very difficult to get in there. You seem to always choke on the water, or the dental nurse might not be doing the suction well, but if it seems to happen all the time, no matter what's any procedure, there's just too much water and you're choking back there all the time, and you've got to spit out constantly. It just gives us signs that things are small and crowded in there. Some people, they open their mouth up, I can see right down like a highway down their throat, and some people look down, I can barely see anything, and there is a big contrast or difference person to person. So, we use things like this to kind of grade how crowded it is at the back of the throat there. So the tonsils, these are quite simple grades that we might use. Like if your tonsils are getting bigger in size, you're just going to have less room through your airway to breathe. So, it is quite common if we look down your throat and all of a sudden we're concerned about your tonsils, then we might refer you to an ear, nose and throat specialist. It's because, that they're creating a big obstruction in your airway. And then another scale like this Mallampati scale, an anaesthetist usually uses, but it's really just a scale to show how crowded it is back there. How much can I see down your throat? So if I can't see down there very well, then there's, you just got higher risk. It doesn't mean if you go home and poke your tongue out, look in the mirror, I'm a level 4, I must have sleep apnea. It's not like that. It's just if you have a combination of high risk signs, then yes, you might be wanting to discuss that with your GP. So sleep apnea treatment, the gold standard has been typically considered CPAP therapy, and it is a fantastic piece of equipment that will certainly help with your obstructive sleep apnea. It is very effective. However, there has been a lot of issues with compliance and people using them because of, the comfort levels. They're certainly getting better than they used to be with comfort levels and side effects to do with the air pressures and stuff like that. So, for some people, if it fits in with their lifestyle and reducing their sleep apnea and they can wear it all night and it's, reducing their symptoms effectively, it is a fantastic bit of equipment. But for the cohort where it doesn't, they need to consider alternatives or sometimes a combination of things to get the best result. And that can still involve the CPAP. It's not to say that you should completely get rid of it. It's just to say that, there are other solutions which can be added in or used by itself. So, for a large amount of people, that might be what they need to do. And then also even for sort of milder sleep apnea cases, depending on the person, is CPAP really like necessary to go for that full hog? Maybe, depends on the person and what their doctor thinks. But splints and oral devices or other treatment options generally can be used just as effectively. So let's quickly go on to what are MASP, well, we call them MASP for short, because look, Mandibular Advancement Splints is just it doesn't roll off the tongue well, it's a very long and big name. But let's just break it down simply. It's just an oral appliance or a mouthpiece which stabilizes or splints the lower jaw, which is the mandible, in a forward position, in an advanced position. So generally speaking, we don't just get you in and just whack your jaw forward and put a lot of stress on all your jaw joints and ligaments and all that. It's just not the right way to do it, and it's often not really necessary at all. So we start conservative, and then we may adjust it forwards depending on how you are coping with it and how much it's reducing your sleep apnea. So we monitor this over time and individualize each person's treatment therapy. Now, the way that they work is really by stopping the soft tissue like the tongue and the palate and the throat walls from all collapsing back on each other, which is the main culprit for the snoring and the sleep apnea. So it's really about stabilizing the jaw and stopping that from your lower jaw from collapsing backwards. So one requirement though is that you do need to have your teeth checked and make sure they're all stable before you go ahead with a splint like that. They rely heavily on the teeth to be used to secure and hold your jaw. So if you have no teeth and you have full dentures, it generally it's just not going to really work, because if you have a full denture on the bottom, they tend to be a bit loose, and that's not going to secure your jaw well. So one thing is that you do need to have teeth to secure a splint like that and do the job properly. So just a warning on like the sort of generic splints that you can get off online or in the supermarket, or not in the supermarket, in the pharmacies. They're just not recommended to use either definitely as a permanent device. You should really definitely not use it as a permanent device, or particularly even as a trial. Like a trial device, it could be used, but the problem is it's just not a good representation of what an actual custom-made personalised splint is. You don't have any guidance, and the main problem is they do tend to be very bulky because they're trying to fit everybody. So if you have a small mouth, which most people with sleep apnea tend to, it tends to just be so bulky that they can barely wear it. Another problem is that because you're boiling it and moulding it yourself, the pressures are just all over your teeth in different ways, and they're not very consistent. So you tend to get teeth movement and problems like that over time. It can not damage, but move your teeth around to where you're not really wanting them to be. But yeah, they're not really good representation, because if they work well, then that's great. A custom-made one probably will work well. But if they don't work well, then that's not actually, it doesn't actually mean that a custom one won't work well. It really depends on why it didn't work. So I have a lot of patients who have used one and they just say it just falls out, or they say this thing doesn't work, and I'm like, okay, and I try to sort of knuckle down into what the problem is. They say it just kept falling off my teeth. Okay, so the device itself might work well if it was secured, but because it kept falling off your teeth, that's just like, it's not actually doing its job. So it's almost like if you had a headache and you take a Panadol and then you spit it out again and think, well, why didn't that Panadol work? So it's a matter of actually getting the device to fit properly. So I think there's a few things there with, generally speaking, you don't really want to go for a splint like that. So, splints should be made, custom-made, precision-made for each person. Should be high quality so that they're going to last a long time. They usually come with, like, say, 3-year warranties, usually last a lot longer than that. And they should have high support levels with, health professionals like dentists to, troubleshoot, make sure you have any issues, we can, rectify them. These days we're doing digital scanning, so gone are the days where we do molds and make all that gunky sort of plasticine and put, it's still done, and I was doing it a couple of years ago, but a lot of us have moved on to scanners now because digital it's just so much nicer, and you're not gagging on the impression material, and the accuracy is just so much better as well. So the splints that you get now, they are quite different from what you would have got 5-10 years ago. So SomnoMed is just an example of a splint company that just specialises in making sleep apnea splints. There are many out there, and I work with quite a few. They're just a good representation of what a good quality kind of splint would look like. So when is a splint like this a good option? So they are recommended as a primary treatment option for mild to moderate obstructive sleep apnea cases. So if you are diagnosed with mild to moderate sleep apnea and there has been a sort of a treatment recommendation for a splint or a CPAP, and you discuss it with your GP or sleep physician, depending on obviously your individual circumstances, it can be considered as you go straight to a splint rather than trial CPAP. You can do either. It's definitely recommended as an alternative treatment option if you're not like CPAP intolerant, so you just really can't use the CPAP, or you're having a lot of struggles with it and it's really making it difficult to sleep because of the certain side effects you might have, or if you completely refuse to use the CPAP, obviously. So we find there are high compliance rates. People use them because they're just a lot less invasive. You can wear them all night without, it's not on you. You can turn in your bed and it's not restricting you. They're easy to travel with, obviously. They're just in a little case. They're portable. You go camping, you go overseas. So they've got a lot of benefits in that regard. And so people just use them more often if they're just less invasive. And we can achieve excellent outcomes, both in sleep apnea reduction and symptom relief, like snoring reductions and stuff like that, especially in combination with things like sleeping on your side, weight loss, or even operations like some ENTs may do, like to open up your nasal airway, things like that. And as I mentioned earlier, sometimes it is useful to keep the CPAP, because if you were a severe case and in your CPAP, the main problem was that the pressure is too high and it's just, you're causing a lot of mask leakage and you're getting bloating. I've had some patients have great success with using a splint and then getting their CPAP recalibrated so the pressure comes down, and they find it a lot easier to use both, actually. It sounds a bit, a bit intense, but it actually, once they get used to both, it makes both the therapies and overall a much better outcome. So yeah, that's really been the talk of when we compare the two. This is a very general kind of view here, but in general, CPAP is going to work more effective than a splint. Okay, in general, for every for the entire population, severe, mild, moderate, whatever. But people tend to be less compliant, so they don't use it as much, but it is more effective. And then we have oral appliances or splints, on the other hand, which kind of have the other way. So people use it a lot more, and they use it for a lot more of their sleep, but just in general, their effectiveness are lower in terms of how well it reduces the sleep apnea. So for each individual person, we kind of shade in the graph of how many squares are we kind of shading in terms of how effective is the total sort of picture here, because you've got to add the two together. There's no point having something really effective, but you only use it 20% of the time, and it's really not an effective treatment. So how many of those boxes can we shade in for each person and make them use the appliance as much as possible, as well as make it really effective? So that's where assessments and things like that, and combining things, you'll tend to shade in more boxes over time. So I think that's where GPs and sleep doctors are now sort of moving towards. They just want to make sure that they're getting an overall effective treatment for everybody who can obviously get a nice combination of both things, using using a treatment, as well as making sure the treatment is as effective as possible. So just got to remember that's a very generalized kind of view. Some people, oral appliance is 100% effective and they use 100% of the time, so they will shade in all the boxes. And some people, the CPAP will be that. So, and then some will be the opposite. So that's where we sort of use both things to kind of, that's where we come in with assessments and things like that to sort of predict that. So last couple of slides. This one is just kind of one to show you, so if you wanted to go or look into doing a splint, where would you start? So as dentists, we do have to be referred, a patient needs to be referred in for a splint. We are acting on a medical professional's behalf to provide a treatment. So you generally start the process at the GP. So if you hadn't had a sleep study or seen anyone yet about it, you should start with the GP and get their recommendations. You might end up going for a sleep study, might end up seeing a sleep doctor, might see an ENT. But if one of them feels that a splint is good for your situation, then they can refer you in for a splint. And that also is important for anyone with private health insurance. There are rebates back for splints like that and dental procedures. So just want to finally say that, we're all on your team. Like, it's not just myself. There's all types of health professionals which are all going to cover the different aspects of your sleep health, and you're in the middle of it. And really, we all want to collaborate well together, and that's what I'm passionate about is getting all us health professionals to work well for that individual person and get the best outcome for them, whether that involves me or whether it involves someone else. It's just all about communication, getting the best for you, really. So thank you very much for listening. I'm also exhibiting today in the hall there, so please feel free to come around and have a chat. If you have any questions, happy to take questions or chat to you afterwards as well.
We've got time now for some questions. If anyone's got a question? No? Sounds like you've covered it all so well.
Yeah, I try to, but feel free to come chat to me afterwards if you need, or send me an email, or check out the website as well, a bit more information on that as well.